So we are on week 3. It's going to go by very, very quick. As you noticed, I have posted exam reviews for next week. Now, as I said, exam 1 is pretty heavy on infants and toddlers, only because of the amount of changes they go through. And that's the lecture that you didn't really see. So unless you've gone, looked at that recording, really reviewed that Cahoots, you're going to be behind. So make sure at least you go to an exam review or you really listen to the reviews. This quarter, we have started there. Every single class has a different exam. So there are multiple choices on each concept, that each professor can choose. So all the exams are different, but the concepts are the same. If you understand, it could be X, front ways, backwards, sideways, it's still the same concept. Talking about, let's say, for instance, an 8-month old, they should be able to sit up unsupported at 8 months old. But you might say have an check all, select all by 9 months. What should an infant be able to do? So you should be able to check that 8 months sitting up, rolling over front to back to front, lifting the head up. Those are things that they should be able to do. So you can see how it's the same concept, but it's going to be presented in different ways. So, and again, every exam is different. Now, I know none of you have given me any accommodation letters, so all of you will be taking your exam next Monday. Remember to come in. I'll be open by 2:15. Remember, you need your IDs to come in on your cell phones, okay? You do have a practice on ExamSoft, and I'm going to open that up for you. You should go over it because ExamSoft has changed a little bit this quarter. They've tightened up a lot of different things with it. So I know you've taken many exams, most of you, on ExamSoft, but I will open that review to go over it. And, I'll probably do that tonight as I'm posting all of your information. I'm really good about getting your recordings up like within an hour after class. And I think that's important. Ciara, did you have a question?
Yes, so today, in my Med Search 2 class, we actually did the practice exam for the exam soft. So will we do it again for this class as
No,
well?
as long as you've done it. But did you see some differences?
Yeah, so now when they do the bow tie, it looks different than what it originally was, and the way you drag certain items is different. But the calculator was like still the same, and then they said that like when you put it on hide the test, it doesn't stop the test, actually just puts it away.
Okay. Okay, so those are some hints. Yes, Kelly, you're on mute.
Would it be okay if we have our dean proctor our exam?
I do not mind anybody proctoring your exam, but to be proctored, I need to know 3 days before. And that person who's proctoring needs to email me, not you.
Yeah.
I do have some students already arranged it for the entire quarter. It's amazing that she's got a proctor and they've already emailed me and all of that. I do not mind you being on campus with a proctor. Be reminded though, there is class right after the exam. So if we start at 2:30, you need to be back here at 4 o'clock. 2:30, 3:30, yeah, at 4 o'clock so that we can give lecture. Okay?
Okay. Thank you.
So that's the only thing. That's your attendance when you come to lecture. And then, of course, your exam's done. Now, does the exam have to be done exactly at 2:30? Not necessarily. Sometimes it's 11 in the morning, 1 in the afternoon, depending on when your proctor can help you. So just to be aware of that.
Thank you.
Are you Cookville? Yeah,
Yes.
I know. I'm very aware of Dean Litterall. I know what he does. We're together because we're both peds person, and I know he does your Sims. We've got a very good working relationship, so it's not a problem.
All right, thank you.
Just let him email me and I'll send him the access code because without that, you can't take the exam. So wonderful. All right, week 3, you have a CJ Sims. Remember, I need those 4 pieces of it. I need your name, the upper right corner. I need the left upper. I need the name of the Sims. I need your score, and I need the date and time it was completed. And there's a way at the end you click a button and it gives you all that. I have some students who do screenshots, take a picture of all different things. Just make sure you do those 4 things. Now, again, like I told you in orientation, if I don't get it like that, you'll see a 0. Doesn't mean you're getting a 0. It just means that I need something different from you, and I'll give you that chance to get it back. Yes, Imani, may I help you?
I don't recall if you answered this question, but is it okay that we advance in like the rest of the modules?
Now, CJ Sims will not open until the week that they're due. You do have open discussion questions. You do have open your NCLEX questions, NCLEX and discussion questions. I did leave them open for you. Just be aware though, if you do them early, are you understanding what those questions are telling you? They do set it up, and it's the reason why NCLEX questions are right before the exam is to review the information that's on the exam. So it's supposed to be a helpful guide. I know it's like tedious time work for you. I know that. And you just want to get it done, but just be aware with it. All right. I do have a lot of things open. For
Okay, and
instance,
as for the CJ Sims and Evolve, there's a way to do like if you have the name of the patient, there's a way that you can actually do the CJ Sims. If I were to do it like the week before and I upload it the week of, are we deducted any points?
no, but remember, if you don't go through the module, that's problems too. You have to do the CJ Sims through the modules and the Evolve stuff, the assignment exam, practice exam through the modules, because then scores don't come over. Now, CJ Sims, it is an upload. So if you can get in there earlier, and I haven't opened it for you, you can. Again, yes, put it on the week that it's due.
Okay, thank you.
I know there's all sorts of tricks that y'all do. So as long as it's up there that week. One of the things that Dr. Brown doesn't like is to have CJ Sims open too soon. She feels that they're more helpful on the weeks of the material that you're covering. So it's just one of her pet peeves, and I'm just trying to protect you from any repercussions from it, okay? I'm not here to say no, you can't, and I understand your plight. I just, as an older person, went back to school for the PhD, and I know what it is to try to just get stuff done. You want it done and get it out of the way. I get that. But just be very careful with that. This is a brand new area of understanding, and children are not little adults. And the only time that their resemblance are the same, I'll tell you, because I have done adult and pediatric nursing. So I can tell you it's the same as adults, same as children with this difference. Okay. So you also have your NCLEX questions due. So those are for this week. Again, check your announcements. I did put your study guide in. I've re-updated it, reviewed it, added extra things I think that can help you with it. I'm the one who did that. And also try, if not, please listen to those reviews. Mine is on Wednesday at 4 o'clock in the afternoon. So if you want to come to that. Also, 6 o'clock on Wednesday, I'm doing a dosage calc review. I've sent everybody all of the handouts, okay, that I might even cover. So if you can do those handouts and you're fine with it, you're good. Now, if you need help, again, I can make it very easy for you. I don't do that ratio proportion, add numbers, subtract numbers. That for me makes a lot of mistakes. I'm going to make it very easy for you to figure it out. So if you want to, you come. But again, the review recording will be posted as soon as I get it done. All right. So this week we're going over school age. We're going over adolescence. I think it's a long period of time from age 6 to 18. A lot of stuff's go on with that. And then, of course, we're going to do a cahoots to follow. And if you all want, we will do a review of the quiz so you know what questions you did get wrong. So let's go ahead and start with our PowerPoint. Anybody, any questions? So it's chapters 34, 35. Now, school age is a long period of time. It's ages 6 to 12. At a 6-year-old, they're still baby like, right? And by the age of 12, they're little adults. So, what they say is school age starts with the beginning of the shedding of those first deciduous teeth, or the baby teeth comes out, and it ends with puberty and all the final teeth are in. So a lot of stuff goes on. Growth at this point is very slow and it's gradual. And even your development is slow, that we're seeing it. Even a 6-year-old is understanding a lot, but by the time they get to 12-year-old, they're able to comprehend a lot more. We know that their physical and emotional maturity do mature during this time. And the one thing about school age children, do not look at a child's look and think you know their age. I'm going to give you a great example. I have a 9-year-old grandson. He's 140 pounds and he's 5'2" already. You would think this kid is a 12-year-old. He just turned 9 and he is mentally a 9-year-old. So you got to be careful. Is their mental, emotional maturity looks like their physical? No, be careful when you're trying to discuss things with children. As I said, their growth is going to be, a little bit slower. They get 2 inches a year, 2 to 3 kilos per year. But during 6 to 12 school age, they could gain 1 to 2 feet and their weight almost doubles. And we know at the end of school age, right now, boys and girls are about the same. It is at the end when girls are more mature because of the puberty that's going to go on with them. We know they get more graceful. We know that their arms and legs are starting to get longer. All the baby fat's going away. They're getting more muscle tissues. That head circumference thing has nothing to do with chest and all that sort of things. And we know that their faces are those little baby faces are now becoming those little young adults, right? Big difference in that. And we know at the age of 6, it's all I want for Christmas is my 2 front teeth, right? Those teeth come out. Now, it doesn't mean at age 6 teeth are falling out. It's somewhere in the beginning of school age. Christian 7, he has no teeth out yet, except the one that he got jammed out from falling down. But besides that, he still has all his baby teeth in. We've talked about their bladder and how it matures. Well, again, now this child we can take more on road trips because they're not going to be stopping every hour to go urinate because their bladder capacity increases. They can sleep all night long because of their bladder, right? Their heart in relationship to their chest and body is now in better relation. It's smaller. Earlier in infant and toddler, it's a big part of their body, and it now, fits into what it should be. Their immune system's getting better because they've had all of these vaccinations and they've been exposed to everything now. So they've had upper respiratories and viruses and bacterias and whatnot. So they're making their own little immune system. Their bones are getting more ossified, which means they crock easier, right? When they're younger, they're more flexible, like their heads, they mold easier, etc. And like I said before, physical maturity is not necessarily correlated with their emotional social. So remember, don't look at a kid for what they look like. look at what their age is and figure out how on their developmental level are you going to talk to them. Now, school age children are pretty smart, and we know that children who are distressed, it could be changes of the home environment, could be a bad home environment for whatever reason. If you start seeing a kid that was a good kid start showing changes or now's always complaining of a tummy ache, something's going on at home. And if you're a school nurse, this is something that you would bring him to the office and say, so what's going on? Why does your tummy hurt? How's home? In that non-threatening sort of way. Well, right at age 10, as I said at the end of the school age, girls start to go through puberty 2 years before boys. That's just what it is. That's why there's a point of time, and sort of remember it, where boys were sort of stupid. They were sort of dumb at this age. You didn't like them yet. They were like, they're acting immature. It's because you're going through puberty. So that is the difference. And it takes about 2 years going through puberty until it's completely done. Okay. So we start prepubescent, we go through puberty. Girls are 2 years before boys. Now, how do you assess a child? Well, last week there was all about infants and how do you assess an infant? I mean, if an infant's asleep, please listen to their breath sounds and their heart sounds because they're asleep. They're not going to be that cooing and moving and all those little noises they make. You can hear it better, right? Well, an older kid, you need to get on their developmental level. And you need to, if you're explaining things, make it non threatening, depending on the age. A 12-year-old, you say you're getting an x ray because you're afraid that they broke their wrist. Well, they'd understand what an x ray is. What would a 6-year-old boy think? It's an x-ray, gamma rays going through, it's going to burn my skin, it's going to hurt, right? Because that's their magical thinking at that age. But it's a big picture. It's a camera. I'm going to take a picture of your insides and it doesn't hurt. And then you show them the x-ray when they come back to the room. And let me tell you, these kids love to see it. They understand it now. Why do I have to have a cast? Or why is my lungs not working? Why am I coughing? I've got pneumonia because that stuff there. Look at that. Now I understand. When you look at abdomens, you inspect, you auscultate, you percuss, you palpate. Lymph nodes in a child, you shouldn't be able to see if they're healthy. They're not sick, you shouldn't see them. And usually we talk about the ones up into the neck, right? Well, if we start to see them, the kid's sick. Something's going on and that needs to be investigated. One of the assessments that you learned in health assessment was that hypoglossal nerve. And how are you going to assess that? Well, it's sticking their tongue out. Well, even infants will stick their tongue out because they like to imitate you by about 3 months old, right? Ever take a little infant and stick your tongue out? See what they do? They try to stick it there because they're really observant of their surroundings. Remember when you're listening to breath sounds, kids have all this upper airway mucus all the time. Kids don't blow their nose right. They don't want to blow their nose right. So you have all this gurgling here. And it could be referred into the lungs and you're not listening to rhonchi. Maybe those lungs breath sounds are clear, but it's all this that's making it sound like something. So if you put it over the trachea at the substernal notch, which is between the clavicle there, you can hear the up top. So know what breath sound you're looking for. Is it the lungs or are you listening to that gurgling? Now, there are theorists, and I told you the first week that, we need to understand a little bit about them. And there will be exam questions, whether it be your Hesse, whether your NCLEX. They like Freud, they like Erikson, Piaget, they like Kohlberg, and a little bit of Fowler. It's just about religious in the younger ages. In the younger ages, your spirituality is what your family shows you. You don't have an opinion yet. That's not till later on. Now, Freud is all about at this time same sex peers. Okay? That's Freud. As toddlers, it's anal. As infants, it's oral. But when we get to school age, it's that psychosocial. That is, they like to be best friends or they gang up with their another one of the same sex. Now, Erickson. Erickson is the most tested of all of your theorists. Okay. So I'm giving you that warning. I gave you a handout on it. It's something that you should review. You will see these questions. And what Erickson talks about is school age children. They have a sense of industry. Like, what does that mean? Well, what it means is they've built the house, they've built their castle, and they understand it, and they did it well. Everything they can do well is part of their industry, their house. Now, they don't do everything well, do they? You might have a kid good at sports, maybe have one that's good at spelling or writing. Now, they can't be good at, let's say, this kid here who is he does spelling really good. Well, inferiority, he can't kick a ball. He can't hit a ball, for nothing. So, Erickson, what I do well is my sense of feeling good and pride. That's my house. That's my castle. That's what I do well. And then things that you can't, they want to do everything well and they can't. Okay. So that's what Erickson talks about. Now, Piaget is all about the way you think and you relate and put things together. We're talking at this point about a child who, younger kid, you give them a nickel and you give them a dime. And you're going to say, which one do you want? Which is more money? The younger kid will say the nickel because it's bigger. Or have 2 glasses of milk. It's a tall, thin glass and a short, fat glass. And you put the same amount. You put the thin glass into the short one, and then you fill the thin one back up. They're the same exact amount of milk in it. A younger kid will take the tall one because it looks like more. So they're starting to understand that it's called this concept of conservation. They also can put, like, for instance, organize, put all their cars, all their trucks, all their red things, their yellow things, their soft things, the hard things, their blocks, they're in order. They have classifications for it. Okay. So they're starting to understand relationships. Could be all the cars and all the trucks and all the pickup trucks, all the vans, whatever. There is a classification for all. And this is sort of what I was saying about the glass and understanding a big ball of clay or smush it, it's still the same, right? Pennies organized or not, as long as they're the same amount, are still the same amount of pennies. And this is what Piaget talks about. Now, one of the other things that they're starting to say, and it happens in the preschooler into the school age, is understanding other people, as in, you see mommy not feeling well, and you'll see this little 4 or 5-year-old will go grab a blanket or a pillow and say, here, mommy, or give them their favorite stuffed animal. Here, it'll make you feel better, right? They're starting to understand others, not so egocentrical like the toddler. Toddlers, all the me, mine, mine. Now, they're also in the concrete stage of development. Again, concrete is what you can see. It's there, it's built, it's concrete. They already seen it, they knowed it, they played with it. That's school age. Now, when they get into the last stage in the pediatrics, It's formal operations. And what I say, and I'll go into it again in adolescence, but adolescents know what they need to do to get what they want. You've told that adolescent, you're not going out this Friday because you didn't or you did. So during the week, what is that adolescent going to do if they really need to go out with their buddies, right? They're going to make their bed. They're going to do dishes. They're going to take out the garbage. They're going to get an A on an exam. They know all this formal figuring it out how to solve the problem. And they're going to have, well, mom, well, you've been good all week. Okay, now you can go out. They know what they can do. Now, Kohlberg, again, right and wrong and a consequence for each. Now, Kohlberg in the school age, they want to conform and they want to do right and they want to please others. That's what they really want to do. The younger stages of Kohlberg, it's that reward and punishment, preschoolers and early school age. But after that, it's more of, pleasing other ones, pleasing parents, pleasing teachers, pleasing whoever, the soccer coach, whoever. Remember, spiritualist Fowlers is the name of the theorist. And remember, at the early age is what the family showed them. Now, school age also are concrete, means they have to see it, touch it, feel it, know it, and then they understand it, right? So wherever, church or home, whatever, they've seen it. Now, they want to know about God. One of the things that these children go through is, for instance, and I've seen this a lot, children coming in that their appendix is giving them heck and they need to have an appendectomy. These are a lot of young school age children, and they think that their tummy hurts and they need surgery because they're being punished by God. They hit their sister yesterday. They didn't do this that they were supposed to do. They believe that's why. Punishment for misbehavior. That's what they believe. Social development, school age, as I said, it's same-sex peers, and they really, peers can influence everything with these children. If your peer wants to do another sport or another activity in school, a peer could talk their friend, their other peer, into doing that. Very, very influenced by stuff like that. We have a lot of clubs starting in school age. We have brownies and Girl Scouts and Cub Scouts and Boy Scouts and going to soccer and baseball and whatever, football. And these are all these clubs. These are peer groups, right? The one thing about, and it should be really watched over, especially when you're talking to family to watch, is that they're watching out for that bullying. Children can be mean and they will bully. And it is the adult that needs to watch that to make sure that they're feeling good about the things that they're doing. Because there'll always be one kid that wants to be better than everyone else and puts everybody down, and that's that bully, right? Parents still are the primary person now, still school age, and they still shape their personality, their behavior, and their value system. Please and thank you, and raising your hand before talk, all of these sort of things. And the parent has to be not a friend. This gets more in adolescent. You have to be a little bit of both, but it's, to talk to an adolescent, sometimes you have to get that almost a friend, right? Now, play is done the whole way through. You know, children, um, love to play. And whether it's play of an organ, piano, a sports, whether it's reading, cooking on the computer, video games, whatever, all of this stuff gives them a good feeling when they can do it, right? Again, sense of industry. I read well. I read 10 books last week. Some kids, that's what they want to do. They're starting to understand what they do well, and they're starting to understand when other kids don't say please, thank you, and are rude. They're starting to understand that. And they're starting to understand that they got curly hair, freckles, blue eyes, long eyelashes, short, fat, skinny. They're starting to understand the different colors of people, of different cultures. They're starting to understand these sort of things. There are other adults that have an influence on the children, and they can help the child succeed or feel bad about themselves. Look at the teachers, after school teachers, the coaches, and any club, Girl Scouts, Boy Scouts. There's an adult that's running that. And again, those adults have the responsibility of making these children feel good about what they're doing, right? They want to have uh, positive strokes so they feel good. That leads to that self-respect, self-confidence. It makes a happy kid. So body image is another thing that we're seeing besides the redhead, blonde hair, brown hair, kinky hair, straight hair, short hair, long hair, no hair. They're also understanding differences, glasses, braces, hearing aids. Maybe a kid, you have one of those children who is in a wheelchair, but cognitively they're on the same level, but they can't walk. And it's probably a myelomeningocele. And we'll go into that. I believe it's week 8. We've got a long way to go. Week 9, actually. We'll go into that. But, these children were starting to learn all of these things, and there are differences, and they're going to have questions. When the kid starts school age, the first thing they do is they're going to go to school. Now, many kids are in preschool, many kids go to daycare, but remember there's a difference in school. They have to sit, they have to pay attention, they have to follow the rules, and there are responsibilities that go with it. Not only taking care of all of their personal things, their pencils, their pens, their crayons, their papers, their books, making sure they have those things. Also, they're responsible for getting homework done. I meant all of that. It is a great place for these kids because now they have all of these kids they're socializing with, all these differences, and they're starting to understand different cultures, different people. Those values are part of it. Nutrition will always be number one in any level child, up to the elderly. Nutrition, 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 especially in children, that are still growing. If you don't put fuel in the tank, they're not going to grow right. You're not going to be able to go if you're a car with no gas, right? Well, same thing with people. If you don't, especially kids, you don't put fuel in the tank, they're not going to grow and develop the way that they should. Now, one of the thing about school age, it's a great age to teach them. And it's a great time to teach them all about different food groups, about obesity, diabetes, getting up and going outside. This is the age that you really need to teach them. I know that, my kids going through it was there to keep kids off drugs. And there was also about nutrition and, being overweight and getting up and going out and running 30 minutes a day and all these things. And kids would come home. Oh, and of course, smoking was a big thing. No, put that cigarette out. I mean, I quit smoking about almost 20 years ago now, but when my kids were younger, they would say, Mommy, that's not good, put it out. And of course, what parents do. We know that a lot of times, especially today, you need two parents working to make a household work. Just one parent is very, very difficult. I was a single parent, so I'm very aware. But sometimes you don't have time with all what's going on to cook those well-rounded meals. And a lot of times it's a fast food, takeout, dinner, or lunch, or just grab and go. Remember, fast food is high in fat, high in carbohydrates, and if it's a mainstay, on children's plates, we know again that's obesity. One of their things is in the internet is something called My Plate, and it's something that we show school age children, and it talks about food groups and seeing are they getting the carbs and they getting, the dairy, etc., what they should every day. Now, obesity, I've mentioned it. We're teaching school age children. And the reason why, well, we know that obesity, we start to see it, it's more prevalent in the school age time. We know it's reaching epidemic proportions. And why? Well, kids prefer to sit on their video games, on their phones, on their iPads, on their Switch, their Nintendo, whatever, than go outside, right? They're not out running around. And when they're playing these games, what are they eating? They're eating snacks, right? We also know there is sometimes neighborhoods that aren't great that you have to live in because that's what you can afford, those low income neighborhoods. But going outside might be dangerous for them. That's one thing why they wouldn't do it. But when we know that we have overweight children, we know that those school age children will become adolescents and adults, and they will have an increased risk, what we call cardiometabolic changes, which means hypertension, high cholesterol, diabetes, because they are overweight. And we know correcting obesity and getting them down to their type of body weight where they should will correct diabetes, will most of the time correct that hypertension and high cholesterol. Okay. So we know early intervention, school age, can prevent it. Now, a lot of these preventative strategies needs to start, of course, prenatal when you're pregnant, making sure that you're eating properly during that, but infancy. Again, nutrition, nutrition, nutrition. Why do you think that we know that an infant at 6 months should double their birth weight? If they have more than doubled their birth weight, the baby's being overfed and now is at risk for being obese, right? We know at 1 year they should triple it. Well, if it's more than that, again, they could be at risk. So understanding nutrition from, pregnancy, very, very important. It's all ethnic groups. There's just not targeted one or the other. It's across the board. And we know that school age children and teaching them has been successful in decreasing the amount of obesity. Now, one of the things that the book talks about is parents making school age children finish their plates. Well, school age children who have to finish all their food on their plates become adults who have to finish all the food on their plates because of routine. And that's where you get obesity again. So they need to eat enough, but they don't need, to all the time finish their food. Now, sleep. Well, we know infants, toddlers, preschoolers sleep a lot. By the time they're in school age, they still need 9 to 11 hours. They still need that to keep their minds alert. There are problems in the early school agers, 6, 7. They don't want to go to bed. They're like, oh, I need another kiss, mommy. Oh, I have to go to bathroom. Oh, I need another hug. Oh, I need a glass of water. Oh, daddy didn't kiss me. And it goes on and on and on. Sometimes that's the resistance. I mean, it's been said there should be some sort of bedtime routine to get those children knowing it's quiet time, read a book or whatever you do, and then get them to bed so that they know that's the end. We know the kids who are older, they're not going to have as much trouble. They know if they don't sleep, they're going to be tired the next day. As I said, sports. We got the bully, right? But as they get older in school age, now we've got the parents in the stands, right? And I live in South Florida, and I've gone to many a baseball game, with my son when he was young. And let me tell you, you strike out, you miss the ball, you didn't tag the base, whatever, parents are going to be yelling at them too. So, is it good? Is it not good? There's controversy. That's what I'm trying to show you. Well, I believe that sports helps with working together as a team. I think it builds physical and emotional maturity as long as a parent is there helping them for the bully and even the parents in the stands that can be a bully too, okay? Because kids love to win, they love competition. Now, dental health. Now, we talked about those baby teeth coming out and permanent teeth coming in. One of the things they recommend is that they brush the teeth before they go to bed, minimum, and they should floss. Now, early school age children, ages 5 to 7, they don't know how to do that floss thing. Okay. So that would be parents that would have to do that. All right. I mean, they got those little sticks now, which are a little bit easier, but usually younger kids don't have that dexterity to be able to do it correctly. So that should be monitored by parents. We know teeth that are not taken care of, they're going to be painful and they're going to be losing them. And if it's the permanent teeth, now you're working into problems. We're going to try to, through flossing and brushing their teeth, to prevent caries, dental caries, and for periodontal disease, gum disease. We know that, kids don't all have perfectly straight teeth. And we know as the teeth comes in, some of these children will need braces, if their teeth are very, very crooked. Now, teeth can be pounced out for many reasons. I've seen it on the side of the pool. They went to get up, slip, and they hit their top of their mouth, and a permanent front tooth comes out. What do you do? Well, it's a permanent tooth. And it came out with the whole root, just didn't crack it, the whole root came out. Well, put it in cold milk and get yourself to a pediatric ER or a pediatric dentist. Many times, don't touch the root, only the enamel, cold milk, get them in there. They'll numb the area with a numbing cream and they'll call in a dentist, like at Nicholas Children. They call in a dentist, might take 2 hours, but they'll numb it and then they'll push the tooth in there. Many of the time, it will grab and you'll save yourself a huge dental bill. So permanent baby teeth, we're not as crazy to stick them back in because they're going to fall out anyway. But of course, they're going to try, if you have the whole tooth, try that too. But permanent teeth, definitely try to get them back in. Preschoolers start with this exploration, looking at each other, seeing each other, playing house, mommy, daddy, right? Type things. And it's all normal. I mean, that's a time where you say, all right, come on, let's go play something else and get them away from that experimenting and playing and looking at each other, right? Absolutely normal. And this occurs even through your school age. Now, one of the things is school age children are very inquisitive. They have questions about everything. And one of the things that we know with this is the child sometimes has a very narrow mind of what they understand. So again, asking them what they know. You'll see this a lot where they have mommy get pregnant and having another brother or sister, right? And they're like, where did it come from? How did it get there? How's it getting out? The question should come from the child and then the parent answer them. They don't need to know all the details on how somebody gets pregnant. Nurses, same sort of thing. Sex is normal. It's just part of it. Touching themselves, masturbation, all normal. So we need to treat it like that. If they're doing it in an improper place, of course, You go to your room and, take care of yourself there. I don't need to watch you or go to the bathroom, right? Close the door. Asking, answering questions again, as nurses. And, there is sex and then just that, difference in boys and girls at sexuality. Again, questions, answer them as clearly and on a developmental level, and then again, encouraging communication with parents. Now, school nurses, I said, I think it's a great field. I mean, those of you who have young kids or planning to have children, it's great to be a nurse in the school where you'll have all those same holidays off as your kids. And school nurses, when COVID hit, really had a huge responsibility, didn't they? They had to keep up with the CDC and they had to keep information going to the parents and the children. And so it was quite big. Many times, school nurses are, they'll appraise kids, look at them, height, weight. Sometimes schools do that, the younger kids. Education, as they get older, and as children get closer, the girls getting closer to going through puberty, doing a class on what puberty is and what to expect. I've seen children with bacterial meningitis come into the ER that are school age. And as nurses, we notify the school, and and it's the school nurse who will send out a letter. And I don't know if you all have kids, but you'll see letters such and such had, meningitis. And if you had contact, your child did, they need to take a prophylactic antibiotic. This is part of school nurse. And it can be that kid with ADHD or kid stressing emotional problems. It's knowing where to find places and referrals for them to go to, and then following up with these children. Now, injury, most common will always be in any type kid, any part of pediatrics. It's always motor vehicles. Motor vehicles causes a lot of things. Whether the kid's in it, not in a car seat, or it's improperly placed. Or I've seen several kids where the aunt, the uncle, the mother, the father, or the next door neighbor ran over the kid, backing out of the driveway. I've seen them be nothing happened, and I've seen, where they died. So I've seen it all different ways. As I said before, when you start seeing a kid getting clumsy, having injuries, things that they didn't have before, um, see what's going on with that child. Again, this might be that something's going on in the family, whether it's an emotional, whether it is abuse. When you start seeing it doesn't add up, there's just too many injuries going on, or this kid's complaining too much of a certain medical issue, check the family. They say a child should be in the rear seat until they're 13 years old. I know that I got divorced from my first husband. My kids were 9 and 11, and they called shotgun from the moment he was gone. So I think I did wrong. I had the 9 and 11-year-old would sit in the front seat. But again, this is updated information. My kids are 40 and 38 now, so it's a long time ago. But you can see how they really have looked at for keeping kids safe. They should be in a booster seat till about age 8. Keep them comfortable. Now, living in South Florida and Homestead, there's a lot of open land. There's a lot of ATVs. You will see them if you run up this one street, on the road, these young kids. It is not recommended for children under 16. Why? Well, they can be on an ATV with another older person driving, but children under 16, they do not feel are mature enough. And not that they're going to, when they get on an ATV, they get and go and you don't see them. And if something happens, they don't feel they're emotionally and mentally old enough to deal with some of these problems. We need to have bicycle helmets on all of the kids who are on there, and of course, safety equipment. Christian just got a hoverboard. I'm not happy with it, but what did Nana do right away? We bought him wrist guards, knee, elbow, and a helmet. And I said, you're not using it unless you put that on, because he likes to zip down the sidewalk, right? And this little 49-pound kid who's a little stick, he's going to hurt himself. So again, using proper safety equipment. If they're in a organized sports, football, soccer, any of these things, making sure they have proper equipment saves a lot of injuries. And trampolines, they don't recommend them at all. There's been a lot of injuries with them, and they're so easy to get today. They're one's in my backyard, and I'm waiting to hear the screaming and yelling. So, school age children, they come into school age, they still need mom, they still need dad to help them, guide them, tell them what to do. As they get older, now they've been influenced by their peers, right? So they're moving away from the family unit. Now they're starting to understand their best friend's family unit. So there's broader sort of relationships going on. And again, you need to let children have their independence, and it's hard for parents to let go. It really is. You want to protect them forever, but you can't. But you can be there, just don't be visible. They call it unobtrusively be there. One of the big things we see in school age is ADHD, attention deficit hyperactivity disorder. And what is it? And what would you see? And what would you be concerned about? Well, children who have ADHD or ADD tend to be these kids who start something, can't finish it, they're antsy, they can't sit in the seat, and they become disruptive in the whole class. These kids don't focus, they don't complete tasks. At home, you'll see them go from here to here to there to there. They're easily distractible and they are all over the place. Now, many parents see this at home, of course. You see a kid who is always starting a toy, leaving one, going to the next, can't sit there, can't finish homework, and their butts are moving all the time, right? They're just on the move. Well, they've probably done things. They've punished, they've taken away, maybe they've taken them to pediatrician, etc. As a school nurse, if you see a child that's looking like this ADHD, that have that inattentive hyperactivity type things, first of all, let the parents tell you what they've done. Don't assume that that the parents have done nothing. Okay. So after you hear what the parents have to say, okay, let's make a plan to help this kid. Because the kid doesn't know why he's up and out and moving all the time. It might be just therapy or it could be medications. And they don't try to go right to the medication. Okay, question. Let's see if you listened. A child has a knocked out tooth. The parents are reluctant to try to re-implant that tooth. Where should the tooth be placed for transport?
A.
Absolutely. Cold milk. I've been asked why before. I think it's the calcium in the milk, and the coolness prevents bacteria because bacteria don't like cold. I'm not sure, but that has been the mainstay and it does work. All right, here we go with some adolescents. So, what is adolescence? Well, this is after school age, so it's like 12 to 20, 21 maybe. And we know this starts in the very, very beginning where they're in puberty. So now they're going from being a kid to becoming an adult. It's now all of a sudden you get this big growth spurt called a pre-adolescent growth spurt, and it's a rapid physical, cognitive, social, and emotional maturation. They're becoming adults. They have to act like adults now, not like children. We know that the beginning of adolescence, that you're going to see the appearance of those secondary sex characteristics. You'll see little breast buds on a girl, and boys, you'll see an enlarged testicles. Well, parents don't see that going on. They usually just see the girls with the breast buds. But again, this is all Tanner's stages of sexual development. We know that there's stuff that we need for reproduction, and then we know there's the changes in the body called secondary sex characteristics. Has to do with those hormones coming. We know voices change, and then we start getting hair in places we never knew. The breasts get bigger, and then those fat goes in different places, and now we're getting curves. Boys are getting big shoulders, um, and this is part of that. As I said, boys, testicular enlargement, girls, those breast buds going on. Now, in the beginning of this prepubescent changing, there's that pre-adolescent growth spurt. And initially, at the beginning of this puberty and those changes, you're going to see many girls have these very irregular menstrual cycles. Now, this pre-adolescent growth spurt, they can grow 20 to 25% of their height and their weight in these about 2 years. So you'll see this increase in height, increase in weight, all these hormones, and they become really moody. And they say the beginning of puberty in girls would be those breast buds, or boys that enlarge testicles, but it's 2 years later in girls that we see menstruation start. So you're going to see changes start, and then you know. Remember, at age 12, all girls and boys should have that 3-dose HPV vaccine, preventing cervical cancer and preventing the HPV virus. Now, Tanner stages, boys, girls, this is what you see. Just know that the stage 1 in girls starts with those little nipple buds, and then it goes into everything normal, the breasts, the curves, it goes into the hair everywhere, etc. And in boys, same thing. It starts with that enlarged testicles, and then it goes into the large penis and the hair on the genitals and the pits and the face and the voice, and et cetera, et cetera, et cetera. So Tanners, something you'll see again. So as I said, that adolescent growth spurt that happens at the very beginning, 20 to 25% of their total height is then. So they're growing like crazy. They're eating. Try to keep food in a house for these kids. It's pretty hard because they're burning up so much calories because they're getting so big. It's usually 2 to 3 years that they go on with this. Sometimes you see obesity with it, sometimes not. And again, we know their voices change. Girls and boys. I mean, I used to be a high soprano. I went to be an alto singer, just going through puberty. Okay, let's go to the theorists and let's talk about what these guys are. Well, initially, we have Erickson. Now, Erickson talks about identity. And then they talk about, what they don't like about their identity, right? So, identity and an adolescent, what do you think they're worried about who they are? Well, do they like themselves? Do they like what they look like? Body image is huge. In fact, body image, not liking it, is a big cause of depression, and that could be a warning sign for suicide in adolescence because they don't like themselves. Also, do I like girls? Do I like boys? Who do I like both? What do I want to be when I grow up? Where am I going to go to school? Am I fitting in with the band club, the sports club, the art club, the theater club? all of these things, they've got to make decisions. And it's a really hard time for them to figure out who are they. So Erickson. Now, social development. Again, they're not with what the parents want, you know? Parents don't always like the friends of their adolescent children. But they're making their choices now. So again, pulling away from the family. There is so much ambivalence. They want mom and dad because mommy and daddy are so good, but now I need to go with my buddies, and I call it the buddies in them. I used to tell my children, "You're going to go with your buddies in them. Is that what you need to do? Go play basketball at the park? Okay." Now, it is what we call intense sociability and intense loneliness. And how would I describe that? Well, adolescents love to be busy, whether it's in school, after school stuff, or going to the movies, hanging out at the mall, going here or there. They always want something. Well, what if it happens where, and again, they love their peers, they have to be accepted by them. What if one of their favorite peers all of a sudden starts dating the boy that you told her that you loved or liked or wanted to date? Now you've lost a friend, right? Now what happens? That's that loneliness where you fit into this group. Now you don't because your peer did something to you and now you're lonely. So sociability, they like to be everywhere all the time. And then that loneliness when somebody's done something where now they feel, distant, they're distanced now from the group. And again, always adolescent body image, too skinny, too fat, too many pimples, too many freckles. My hair's too kinky, it's too straight, it's too this, it's too that. And again, the clothes I wear, are they up to date with what I should be doing, right? Parents, again, this is a really hard time. It's full of a lot of turmoil. And as I said, that ambiguity, which means that these children want to like their parents, but they don't want parents to tell them what to do. And we know that adolescents think they're old enough now to do what they want to do, and they do a lot of risk-taking things. This is where a lot of other injuries can occur because they feel that they're old enough now. Specifically between 15 to 17 years old is where these children fight for their own independence and they don't want mom and dad to tell them what to do and how to do it. But they're going to say, "Hey, mom, can I have $20 to go to the movies?" Right? So it's that sort of thing going on. So what is suggested is that parents sit down with these children and to try to set a limits. Like, you can't come in at 1 o'clock in the morning. That's too late. You're 15 years old. You can't, be like that. So these kids coming at once say, "Okay, be home by 12 on this date." You got to work up what's going to work. And again, it has to do with privileges and responsibility. Teenage think that everything's their privilege and they don't need to take the garbage out. They don't need to be home for dinner. They don't need to make their bed, etc., etc., etc. Peers are really, really important in peer groups. And this is where they feel their strength and power when they're buddies in them and they're together. And this is when they're out and they're being social, the big sociability now, right? Best friends are important. It's usually same sex, not always. What they say is that how you treat your best friend as an adolescent is how you're going to treat your partner for life. So it does those building blocks at that point do go on later on in your life. Now, talking to adolescents is really difficult. Adolescents want to do they don't want to listen to adults. Now, I'm an adult. I worked my last 10 years in a pediatric ER, and I had a lot of teenagers coming in for many different reasons. And I'm an adult, I'm an old person. They're like, I can't trust you, but you need to be able to have them open up. So, what would I do? Try to make it a little personal, but very inconspicuous. Well, number one, if they're listening to music on their, their phones, I'm like, so what sort of music do you like? And I know a little bit about current music, so I might mention something. Or maybe I see they've got some really cool sneakers on that, I wanted to get my kids or something. Where'd you find them? How much were they? Something like that. Or they've got on the sports shirt. Oh, you like the Yankees? Oh, they're my favorite. Talk about it. Another thing is, especially today in today's climate, seeing, let's say, a young girl dressed up more masculine, I would ask that girl, what do you want me to call you? I've seen children, their name is Rachel, but, could you call me Ray, please? And with that, I've built a respect. So there are ways you can do it. Another thing is to be able to let them talk. Now, many adolescents will not talk in front of their parents. And what if, let's say, you've got a girl coming in and it's her third urinary tract infection this year? Probably it's due to sexual intercourse, right? Most likely. So have the parents step out of the room and say, so how do you think you're getting all these urinary tract infections, right? You've built up this little rapport, and then sit there and listen. Now, adolescents like to say things that will shock you. You don't expect it. I have learned to be a poker face because some things I'm like, okay, but I don't make a comment on it unless it's behavior that's going to hurt themselves or others. Okay. Another thing with like sexual type of birth control, this and that, make sure you give them information, talk to them about it, and then give them it in written form too. Now, what I've told that child, and we spoke about behind closed doors, I do not have to tell the parents unless it's going to hurt themselves or others. Believe it or not, you can be their resource, somebody to talk to help them through whatever they're going through. And then I would tell them, remember, there's a school nurse. If you need more help, they're there to help you. So just go to them. So, school nurses again. So, health. Adolescents are on the run. They're take a bottle of water and a power bar and they're out for the day and they don't eat all day long. Nutrition isn't good. They, tend to not really take care of their health the way they should. So, number one, that HPV, that 3-shot series should be done. It's for girls and it's for boys. Also, adolescents having medical issues, one of the things I would say, because remember, nutrition feeds the fuel to the body. If they are chronically getting ill, it could be a nutritional problem. Get a 24-hour diary of it. What's going on? And that 24 hours is going to tell me, are they eating the good things? And also, you see in weights going up and down, always be concerned, is that a eating disorder? Now, in the beginning of adolescence, they're growing that first 2 to 3 years, they're growing 20-25% in their body, their height. They should be getting sleep, but what do adolescents do? They're on their phones talking to their friends till whatever time. Oh, they got a new boyfriend, okay, all night long. Or they are hitting the books because they need to get that scholarship because they want to go on into college and they need that, okay? Or, they had to go to the baseball game and, they don't have time, they're doing their homework. So sleep is always interrupted by schoolwork and then their social habits or activities. So sleep, they don't always get it because they're too busy. They don't have time to sleep. We know exercise should be encouraged. And then again, dental health. They've got permanent teeth in, letting them know brushing and flossing are so important. As I said, sexual education, it looking at, let me, this is crazy. When I was a child, Lucille Ball was on. I Love Lucy, right? And the day that they showed an episode in the bedroom with two twin beds for Lucy and Ricardo, right? It was this big, like, I don't believe you showed a bedroom on TV. Well, look what they're showing today on TV. Sexuality like crazy. You can see them literally engaging in sex on normal TV. So they know they're getting that on TV. Now, if they limit, it's going to help, today. I'm not really sure. But what we can encourage is, to ask questions so they know proper information, not what they think they've heard. And we know parents, they should ask. I wouldn't have, not my mom. My mommy would have taken me and put me on lockdown for my life. I had 6 brothers. I'm the only girl. I'm not going anywhere. But there was school nurses and there was Planned Parenthood. There still is today. Hopefully we can continue that. Now, safety promotion. Well, I've already said, what's the biggest one in any sort of injuries? It's always motor vehicle. Now the kids are teenagers and now they're driving cars. And then we know driving cars, they have kids on the hoods of the cars and parking lots trying to, see how long they can hold on for on the outside and then throw them off. I mean, injuries like crazy. We know that now they're old enough. I'm going to go look at daddy's gun. Let me look at it. And we know those things can go off, inadvertently. Sports injuries, and injury prevention, but sports injuries, kids who are adolescents, they're in sports and they want to win. And sometimes they get up and go and they push themselves where they shouldn't have, whether they didn't warm up, or whether, they just, went beyond their physical limits. So all of these things are real. The kids need to know, proper equipment and warming up and then, injury prevention. Now, Matt is age 14. He's always eating, although his weight is appropriate for his height. What's the best explanation for that? Remember, that's the first 2 years of adolescence. What happens in those first 2 years? 2 to 3 years. They gain 20 to 25% of their height. So is that normal or not normal? Anybody?
It's normal.
It's normal.
Absolutely normal. The kid's getting bigger. He's, like I said, you can't keep food in the pantry on these young children because they're eating, 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 and they're still skinny, skinny. All right, any questions so far? No? So you like school age kids or you like adolescent kids? Or you like the younger kids?
I prefer younger.
Yeah, I do too. I really, really do. School age, so many questions. So many questions. All right, we're going to do the cahoots. Again, you can use your camera and connect with that little code up there. It's the easiest way. And it actually, it was only last quarter that I learned that from a student. So I did send you all the Cahoots weeks 1, 2, 3. And I did send you that study guide for the exam. Make sure, go back, look at your PowerPoints, look at those key points on it, and you'll do okay on your exam. And anybody who needs a one-to-one that you're scared, anybody who's had to repeat or is coming back to school, you want help, ask me. I will help you. All right, let's go ahead and get started. School age adolescent, week 3 already. Goes quick. How does the onset of pubertal growth spurt compare in girls and boys? It's 2 years before boys. Girls are first. I don't know if you remember back at that end of elementary, middle school, where you were taller than all the boys, and the boys seemed to be shorter and more immature. That's how I remember that one. I remember it clearly. That's a long time ago. Multi. What activities are appropriate for a 6-year-old child? So remember, school age, want a sense of industry. They want to be able to do stuff and do it well. And if you give them something to do, they need to be able to accomplish it. Okay? And the only thing here we shouldn't do, well, a card game on a 6-year-old, they don't know how to do that yet. That's a little bit above them. So they'll get frustrated. So again, sense of industry, they're going to be upset. Now they're and feel inferior. And organized sports are pretty rough on a 6-year-old. They don't really have that attention span and their maturity's not quite ready. They can ride a bike, they can jump a rope, they can skip, they can do those things. But the other ones is a little bit early. At what age should a parent expect to have major conflicts over independence and control with their child? I'm old enough, I know what I'm doing. You can't tell me what to do. And it's that 15 to 17. They're just over that adolescent growth spurt. So now they're taller, looking like young adults, right? And they're just not quite adults yet. And yeah, they'll give you a run for your money. I call it the roller coaster age. Signs of onset of puberty in girls. What does it start with? And remember to review Tanner. It's on your study guide, so you will see it there. I know on the Hesse we have seen Tanner, just to let you know. And it's development of those breast buds. Absolutely. I mean, their voice deepens a part of it, but number one is the breast buds. The onset of puberty in boys is characterized by, I mean, as mothers, we usually don't see this, but this is part of it. And it starts out with testicular enlargement. And then it goes into the hair and the increased size and voice, et cetera, et cetera. But number one is testicular enlargement, according to Tanner. What do we use to determine if a female has reached the age of menarche? Huh. It's all about Tanner stages of development. Yes, very good. A child goes to the ER with a low fever, pruritic rashes with open, oozing papules. Nursing care includes what? Well, what could this be? And this used to happen, occasionally with me. Well, the rash, open, oozing papules, that means this could be chickenpox. Chickenpox is airborne. And just because you've had a chickenpox varicella vaccine, you still can get chickenpox. They used to tell me that was all levels of healing on this rash and these oozy papules. Now, put a mask on yourself and get that kid into a room where they're not breathing and giving it to other children who are susceptible. The source of injury, whether intentional or unintentional in adolescence, is associated with what? Injury. Motor vehicles, number one motor vehicles. And then you go to adolescence, homicide and suicide are there, but number one, motor vehicle. If a parent feels uncomfortable talking about sex education, who's a good resource? And the school nurse. The school nurse is always there, always available. And, what part of her job is to have those resources and pamphlets and handouts, et cetera, for them, to help guide them. A 9-year-old friend tells him soccer's a dumb game and he should play baseball. Why is he saying that? Is that a good thing? It's his friend. So remember, this is all about same-sex peers. And as I said earlier in lecture, sometimes one peer doesn't like one thing and persuades the child, their peer friend, to do what he wants them to do. And it's absolutely normal that a peer would change. Instead of playing soccer, they're going to play baseball. It's just a part of it because that acceptance is very important. During admission, the father of a 16-year-old says, "We are Buddhist." Culturally competent care includes what? Well, if they're Buddhist and they're telling you that, there must be a reason for that. So you're going to say, "So what do I need to do for you?" Now, you could talk to the 16-year-old too. It's not just the father. You can ask the child, is there certain things? It could be that they're vegetarian, or they don't eat pork, or they don't eat beef, or they need time for prayers. Whatever it is, that culturally competent care, that you will give them that time or you will give them what they need. Very good. When teaching sex education and contraceptives for adolescents, what should the nurse consider? So what you need to do is make sure you're going to give them education. Yes, you can. You're going to talk to them, and then you're going to give them a pamphlet, something in writing so that they can go and they can look at. A multi. The management of adolescent obesity should include what? Now you have an adolescent who's overweight. What do you need to do? Well, number one, you need to know what they're eating. So that diary is absolutely good. Also, there need to be like that reward day. So we need some of that favorite food in that diet. You can't just take everything away. And I'm sorry, you're not going to offer me a nutritious carrot as a reward. That's not a reward for me. That reward would be that favorite food, okay? And diversional activities, that's younger kids, and it really wouldn't work for obesity on an adolescent. Infants go through a predictable sequence of growth and development. This is called. You'll always see me throw something in from the week before. Always. This is called sequential trends. It's sequence. It happens in a sequence. Yes, it is in the question, but it is the answer too. Which benchmark serves as the ending period for school-age children? It's the onset of puberty and all of the permanent teeth are in, right? Starts with the shedding of baby teeth and it ends with puberty and the permanent teeth. Which action would improve dental health in the school age child? And this is all about flossing, making sure, I mean, most children, parents, have them morning and night, brush their teeth, but it's the flossing that really helps improve it. And remember, children under the age of 7 and 6, it's very hard. The dexterity is not there for the flossing, and they do need help with it to let you know. That's what it says when they are able to do it by themselves. But before that, parents do it. Generally, the earliest age at which puberty begins is, and again, that 2-year span, 10 in girls, 12 in boys. Very good. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Why is she saying that? This is an absolute belief. I mentioned about the child whose appendix hurt and burst and they need an appendectomy. I would sit down with these children and say, you didn't do anything wrong for your appendix to not want to be there anymore. So it's a piece of tissue and all of a sudden it needs to come out. And I says, don't worry. You didn't do anything bad. It's not because you hit your sister or you did bad on your test. It's just it happens. Also, I'll tell the doctor to put an extra stitch in your belly button so your insides don't come out. especially your younger school age children. You're going to watch their shoulders drop and you're going to see these children relax because this is what they're thinking and they don't know how to express that to you. I've done it over and over again. A 6-year-old needs to get a chest x-ray. What explanation is the best? I want to have some gamma radiation rays go bzzz into my chest, right? Remember, you're 6 years old, you're still a child. It says we're going to take a big camera, we're going to look at your insides, and I always show these children their pictures. They understand, they will take care of themselves better, believe it or not. Even your little preschoolers and some of your toddlers, they understand. How do you get an adolescent to open up about their sexual history? Hardest thing I've done is work with the adolescents and having them open up. And talk about something else. Break the ice, let you know that you're not threatening, that you're okay. And it does really help. How can you get an adolescent to be more receptive to talking about the health and sexual explorations? Have the parents leave the room. And at that point, I say, listen, I don't have to tell your parents unless you're going to hurt yourself. I said, you can talk to me. How can I help you? I don't want you to have another urinary tract infection, or I don't, whatever it is that they're there for. And they do then open. And again, I tell you, be prepared for what they're going to tell you. Some of it's crazy. A multi-select. When educating adolescents about the risk for HIV and hepatitis, what would you include? I mean, you've always gotta, especially, if their condition has to do with possible sexually transmitted disease, right? I mean, you're going to tell them they should be abstinent, and they're not going to listen, right? So then you go on to at least use condoms for sexual intercourse, and let them know that you can help prevent pregnancies, so better for that. Sexually transmitted disease, HIV, hepatitis, and then hand washing is a simple thing. And then we want more than weekly showers. They're going to stink if it's only once a week. A child has a knocked out tooth. Where should the tooth be placed for transport to the dentist? I love that little boy in this picture with no front teeth. I think it's so cute. I'm waiting for Christian. Not yet. And you put it in cold milk. Again, don't touch the root. If the whole thing comes out, only the enamel, put it in cold milk. Go to a pediatric dentist or pediatric ER, and they will take care of it. I've done it many times. A nurse planning care for a school-age child should know which thought process is seen. School age. Animism, magical thinking are preschoolers. Okay? That conserve about the tall glass, the short glass, the big thing of clay or the squat of clay. Those things is all about the conserves. They know the differences between things and what's similar and what's not. And a nickel is not bigger than a dime. They're understanding those things. And thoughts are all powerful. I don't know what that would mean. They think they're God. I'm not sure. What stage of Erickson would you use for this school age child? School age children, they build a house, right? Their industry. This is their house. What they do well, they've made a beautiful house of all the good stuff. But I can't do everything well, so I feel inferior. Trust versus mistrust is your infant. I trust when I cry, someone's going to pick me up for whatever needs are met. Initiative versus guilt. This is what we call preschooler. Preschoolers like to do things, but they're afraid they're not going to do it all right. Autonomy versus shame and doubt. Who's the autonomous of all the levels of children? The egocentrical, the me, mine. It's your toddlers, okay? And the autonomous is doing things. They're going to be into everything. And it's the shame and doubt is mom and dad and grandma saying, be careful, don't do that. You're going to hurt yourself. Watch out. And then industry versus inferiority. Why do we need to know that industry? Well, when you give a school age child something to do, you need it to be something that they have the ability to accomplish with a little bit of thought. And if they can't accomplish it and it's beyond what they can do, they're going to feel bad about themselves. They're going to feel inferior. So that's what that means. School age children's moral development. Moral. Who talks about morality? And what does that theorist talk about? Right and wrong, and it's based on the consequence. And again, school age children are pleasers. They want that praise. They want to please. They don't want to do wrong. And then they become adolescents. Anorexia nervosa is characterized by what? Now, I can't put everything in all the PowerPoints. So I've given you a couple slides on 2 different eating disorders. Anorexia nervosa is about what? And I'll explain it once it's finished. So anorexia nervosa is a fear of anything in the mouth, even a lettuce leaf or water, making them gain weight. So they are fear of gaining weight. They don't eat anything, less than 100 calories a day, some of these. And it's that unrealistic body image. Vomiting and purging is the other eating disorder called bulimia. And that's where they eat these unbelievable amounts of food and they vomit. Now, how would you know which one's which? Because they're both eating disorders. They both tend to have a very small framed, underweight child. Well, if you're vomiting, what are you vomiting? You're vomiting acid from your stomach. What does the acid in the stomach do? It eats your teeth up. So a bulimic child would have rotten teeth. Okay? Anorexia nervosa, no, because they're not eating anything. And they're exercising, and burning off those 10 calories of that lettuce leaf that they just had. How do you know if you suffer from bulimia? And it is that binge eating, purging behavior is very good. They're both eating disorders. Adolescents are what? I always said as a single parent raising, a boy and a girl 17 months apart, boy first, it was like a roller coaster. I had to hold on tight. I couldn't give up. And I got lucky. They both turned out amazing. I don't know how, but they did. It's somewhere between being a kid and an adult. They don't know what, they're all about. So it's that in between. And also, they're frustrated, remember identity, they're always going through, you know, adolescence can be mean. You lost your best friend, he's dating your boyfriend, you're alone. I mean, all of these things, adolescence. I don't want to ever be another adolescent teenager again. What is an adolescent's heart rate? Hmm. I mean, we talk about infants, that neonatal part is that first 28 days of life is 140 to 160, right? With 40, 60 is a respiratory rate. Adolescents, slightly lower than your adult, that 60 to 100, because they're a little bit more active, usually. So 55 to 90. If you had an adolescent with a heart rate of 120, I'm going to be checking for temperature and I'm going to be checking for volume depletion, dehydration. Something's going on. Or pain, right? Those are the things that you see with an elevated heart rate. When talking with an adolescent regarding personal health concerns, which is most important? Absolutely. Let them talk about whatever, okay? And I'm telling you, be prepared. They're going to say things that you no clue about. A parent says their infant puts everything in their mouth. Based on Freud's theory, you would respond. Again, something from last week. It's how they explore the world. It's how they self-soothe through their mouth, right? Very good. And remember, it's the oral stage. Freud is oral. A multi. What could be a sign of potential child abuse? Now, I've seen child abuse in my years just in the emergency room. And I've seen them withhold food, and I've seen a child physically beaten with broken bones and femurs and ribs and stuff. I've seen both. And I'm telling you, I'll never forget these kids as long as I live. Usually, when you see child abuse, they come in, let's say they have a broken arm, let's say. And, it's good to get the story from the parent. And then when you're in the x-ray room to say, so tell me, how did you break your arm? Is there any inconsistencies between the stories? The other thing is you might see a child where what they're telling you just doesn't make any sense at all. And then the other one is the kids are afraid to talk because mom said, don't you dare say anything or I'll beat you when you get home. And this is reality. I mean, I wish there was no child abuse, but I'm telling you, there is. It's real. And child abuse is the nurse's responsibility, where you report it to your charge nurse, who reports it to the head physician, who reports it to the police and to DCF. If you're in doubt, protect the child. Pediatric nurse's job is to protect the child that you're working with. I've seen it in 3-month-old infants. In addition to injuries, the leading cause of death in adolescents ages 15 to 19 are, remember, they know what they're doing now. And it's homicide, suicide. It's like they pick up the gun, right? And shoot it. Or they do these, tricks on the car and people fall off when they run over them and they kill them. And then, of course, that body image where they get to the point of such deep depression they commit suicide. It's a reality. It does happen. In school age, conflict of industry versus inferiority. What does industry mean? Remember, it's the building, it's the house that they've built. Industry. It's what they do well. It's mastering that task, whether it is athletic, whether it's, your math, your spelling, it's mastering something. Very good. What age group prefers to be with members of their own sex? We could describe this as same-sex peers, and it is about 7 to 11. They want to hang out, and remember, those peers can influence things that they do, whether it's sports or clubs, et cetera, et cetera. True or false? Home support is invaluable to the adolescent. Do they still need mommy and dad? Absolutely. Where do they go if something happens and there's nobody else to turn to? Their whole world fell apart. They need mom or dad to fall back on. They still need to be there. And mom and dad can't let go because at this point, if you let the kid run, those are when things happen. So they need, it's not as visual as school age or younger, but they still need mom and dad there. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? So, any problems with nutrition, dry skin, intolerance to cold, constipation. That's also hypothyroidism if as we get further on into different diagnoses. But remember, decaying teeth is the vomiting, and the vomiting is the bulimia. And that's when you would see in bulimia, not anorexia nervosa. A 14-year-old in the emergency room after a biking accident. How should the nurse interact with this adolescent? Now, I was a trauma nurse all the time. Primary trauma nurse means that you're in control of whatever's going on there. You're making sure what you need is there, and you're directing who's there to get you what you need, right? Now, I'm standing there with this adolescent and I'm explaining everything. Okay? And are they asking questions? If you can imagine you're in the ED, probably it's a trauma, biking accident, coming by the helicopter. They're scared to death. And all of a sudden, poof, you have 28 people running after you. So I'm explaining, we're going to do this, we're going to do this, we're going to do this. And that helps alleviate all that stress and fear. That helps, especially if they're bleeding, right? Elevated heart rate and, getting excited, gonna bleed more. Calming them down helps in so many ways. What is cooperative play? Again, last week. We have parallel play, we have solitary play, we have associative play, and we have cooperative play. And cooperative play is when two or more kids working together and there's a goal. There's something somebody's going to win, or they build the house. Associative play is when they're playing all together, but they're all just playing together. And then parallel play, and that's preschooler. Playing next to each other and they're not touching each other toys. That's toddlers. Remember, they don't like share. Me, mine, mine, mine. So those are things you need to know about play. What does moral development involve? Again, moral, Kohlberg, right, wrong. As we get older, we understand more about it. Why is it right? Why is it wrong? So it does. It changes in thoughts. Developmental milestones are important to observe because of what? Why do we need to know when a kid should lift their head up and turn over and walk and talk? And why is that important? It's because if they are not meeting certain milestones, we know that we need to find out why. And or we need to institute an early intervention, speech or physical or occupational therapy, catch these kids up. And as I said, children are so resilient. They catch up so quickly, but it's the earlier the intervention is started, the quicker they catch up. Lymph nodes in children with normal findings should look like what? Shouldn't be able to feel them at all. If they are normal, they're healthy, you're not going to feel them. When they're lymph nodes, there is some sort of infection going on. Depriving a child of food, clothing, and shelter is called what? That's called neglect. That is what we call neglect. I saw one, I don't know if it was news or something. Kids were outside. It was 30 degrees. They were in the front yard. A ball went out into the street. They're outside without coats on at 30 degrees. So the ball went there and a car almost hit them. And of course, the police came and they went to arrest the parents. And why? It was 30 degrees and the kids didn't have coats on. Not that the ball went into the street, but they didn't provide them with basic clothing that they needed for 30 degrees. So, I mean, that is neglect. Which of the following immunizations is given in the adolescent stage? I think I mentioned at least twice. And again, boys and girls. And it's the HPV, and it's that 3 series. Very good. ADHD most likely involves which of the following? Attention deficit hyperactivity disorder. Very good. Inattention, distractibility, impulsivity, and hyperactivity. Very good. A multi. An adolescent's been brought to the ER with a drug overdose. What is the initial questions to ask? Well, we want to know what drug, when they took them, and how. Because is it IV? It's going to go away quicker. PO will last longer or nasally. We want to know those questions so we can treat them the best way. Rehab has nothing to do with you're in an overdose state. They're not even thinking of that right now. And last question. Adolescents typically place blank on peer relationships. And absolutely high value. This is what they do. Their buddies are more important than families at this stage in their lives. So number 3 was a DS, and number 2 was a B and a little b, and number 1, Turbo. Okay, Turbo, and KSS and Miss Fig. So that's what I have for today. Um, I'll go over that quiz if anybody wants to stay and watch it. If not, remember, there is exam next week. Come in a little earlier. Make sure you have your ID, whether a license or your school ID. They're both good. We're going to come in on your cell phones. Make sure you do the 360. And I will be setting up that practice exam to go over those changes that have been going on. Okay? Anybody who needs a one-to-one, after you watch a recording of somebody, I mean, mine's on Wednesdays, so you have Thursday, Friday to ask me. If you need me to help you, I'll go over concepts that you're not getting, okay? My goal is all of you pass. That is what I want. So you need to reach out and I'll help you. And remember, I want nobody to get any math question wrong. And you'll have also that recording, or at 6 o'clock on Wednesday, you'll be getting that review too. It's a CJ Sips, it's your NCLEX, and getting ready. So thank you guys.